Hi everybody, Dr. Baumholtz, Baumholtz Plastic Surgery, and today we're going to talk about drains. So there are some surgeries that require drains, so I just want to spend a minute or so talking about the best way to care for your drain so that you are an expert on drain usage. So this is a traditional bulb suction drain. This one happens to be a Blake style channel drain. Let's see if I can get in close enough. And you can see rather than having lots and lots of little holes, this particular drain has channels cut in it, and there's a couple advantages to that. The first is when we go to take it out, most of the ones with holes have a hub, or they get wider, so they're uncomfortable when they come out. When this comes out, it's the same size the whole way, so it slides out through its hole. All right, let's talk about how to care for it. So the drain is attached to your body in some way, typically, let's say a tummy tuck, right? So it might be coming out the side. And so what you want to do periodically through the day is you want to secure with one hand the part that's coming out from the body, and with the other hand, you want to do what's called stripping the drain. And stripping the drain is you squeeze your fingers and you slide, which flattens the drain, okay? And then you want to hold this and then let go, and that's going to pull the fluid through the drain. And we're going to do it again and again and all the way until we get to the bulb. Okay, so that's stripping the drain. Sometimes you may find it easier if you wet your fingers, or here in the office you might see us use an alcohol pad. That's just to help us slip along and get to one side of the drain to the other. Now, in terms of the anatomy of the bulb, let's talk about this for a second. So we've got two ports here. The drain actually attaches typically to the smaller one. Let's see if I can do that on camera. Here we are. Great. So we've gotten all the fluid in here, and you can see there are some markings, 25, 50, 75, 100. So you'll take the stopper out, squeeze it into a cup after you've measured it, and then record it, and then squeeze the bulb down, squeeze this grenade or bulb all the way down, and then take the stopper and put it back in. Now, if you've had, do you hear that sound? That's because there's a leak. That's okay. If you've had the drain for some time, what you want to make sure is from time to time you take an alcohol swab or a little, something to clean the stopper, and then squeeze the drain down and put the stopper back in, just like that. Okay, that's everything you ever needed to know about drains. I hope this was helpful. If you have any questions about your drain or any plastic surgery issues, especially in the postoperative period, call the office 210-920-2390. Thanks very much.